My name is Jamie Dudensing, and I am the CEO of the Texas Association of Health Plans. Health plans and pharmacy benefit managers rely on step therapy as one of the several methods to encourage enrollees to use the most appropriate drug at the best value. So often when you hear about brand versus generic, that's a good example of many times there's a lower price drug out there that costs 75% less than a brand name drug. And so we use step therapy for that purpose to help provide cost savings to employers. About 69% of employers choose to add step therapy to their benefit coverage, but it is usually a choice of an employer to decide when he's purchasing coverage from a health plan, do I want to add step therapy into the plan to help provide this coverage and provide value in the coverage. We also use step therapy to deal with harmful side effects of drugs, and often when drugs have an unsafe interaction. And when it comes to talk about the cost of drugs, I think it's important to point out that right now drugs are the highest, fastest growing cost in healthcare. In 2009, they were 16 cents of every dollar. They have now grown to be 22 cents of every dollar of every premium, which is now more than what we spend altogether on physician services. Additionally, there is a strong impact on advertising that goes on with prescription drug patterns around brand name. And 9 out of 10 of the largest pharmaceutical companies spend 50% more on advertising than they do on research and development. So there's a huge amount of money and investment that goes into, encouraging the prescriptions of brand name drugs and advertising around those brand name drugs. So we really depend on step therapy to deal with the fact that drug costs are astronomical at this point and growing at 12 and 13% a year. That being said, we do support consumer protections for around step therapy. We do have some concerns in the bill, but I think it's important to line out our support. We do support the mandated exceptions to the step therapy process. So ensuring that there is an exception to step therapy if someone's already failed once, for continuity of care around changing a plan or formulary change. If there's probable death or serious harm, it's contraindicated, an adverse reaction, it's ineffective or not in the best interest of the client. We do think that these exceptions would provide protections for consumers. We also support the expedited review and having an expedited appeals process for consumers. Our concerns go around ensuring protections around cost control and utilization, including ensuring that providers do have to provide documentation for these exceptions so that we can ensure patient safety, appropriate pharmaceutical use, and ensure that we're reducing fraud, waste, and abuse in the system. We are also concerned in the bill of having to have a completely separate Pharmacy and Therapeutics Committee process instead of using the existing one that's already in place for Medicare and all other commercial lines of business. We are concerned about the public review. The P&T committee is quarantined on purpose so that there's not inappropriate lobbying by pharma to have certain drugs placed on the formulary. And last, we oppose the limitation to the AB generics before an equivalent brand. That would limit us to one type of generic that would only be available for step therapy, where there are 14 additional generic ratings that are available, and the ability to do brand-to-brand generic substitution along with biosimilars. So we want to ensure that we still have the ability to do step therapy, but there is a safe process to ensure that clients have those mandated exceptions available to them.
Thank you very much. Members, any questions? Senator Campbell.
Thank you, Mr. Chairman. How long does a patient have to go through step therapy? Let's say a specialist like Dr. Bass, a neurologist, knows that a new drug really, works for MS, and how long does the patient have to stay at the old treatment that was based not on cutting edge research and technology? What's the time frame? Because, once I see a specialist, that kind of bumps up the knowledge base and everything. How long do they have to wait?
Right now, our step therapy have to be based on clinical criteria and guidelines that have been developed by physicians. And as Senator Hancock mentioned, there is an appeals process. I think that there's some concern about the length of the appeals process, but we do support these exception criteria. So if a doctor had any parts of these exception criteria and provided that documentation for it, it would be approved within 72 or 24 hours.
And Senator Campbell, there's some elements. I think we're going to be able to find a
Happy
good
medium.
landing spot
Okay.
on this.
All right.
Not on everything, but
Okay.
on most things.
Well, I agree. It's a step. I just want to make sure that we're not just for the dollar price. We've got some folks out there that have severe pathology, disease processes, and we've got the technology out there to help them. And that is almost like the ounce of prevention is worth a pound of cure, because they're actually getting the right treatment for their problem. Thank
And
you,
we
Mr.
agree.
Chairman.
And I believe the exception criteria that are lined out in the bill and that we support would cover all of those cases that you just heard in the testimony and the type of cases that you're talking about now.
This is kind of step legislation. I think you'll like the next step.
Members, any other questions?
Thank you.